So, Hajar, I'm thinking about a couple of episodes ago when we asked each other, would you like to be a doctor?
Oh, yeah.
And we both decided,
No, we
no,
too
exactly.
stressful,
We would
right?
not want that. But I think in all that, we might have missed something. Because I think doctor might actually not be the most stressful job in the hospital.
Really?
Yeah, I think being a nurse might be, at least just as tough, but maybe even worse.
Wow, really?
Yeah, because, think about it. Doctors are the ones who make a diagnosis and set a course of treatment, right?
Right.
And totally high stakes stuff. You don't want to get that wrong.
Yeah.
But nurses are the ones who have to execute that plan. So they're the ones who are having to be with someone when they're going through the side effects of chemo or experiencing a psychological crisis or all the million things that happen every day in an oncology department.
Wow, yeah.
And that stress really adds up. And so today we're going to talk about something that is a really big problem, which is burnout among
Mm.
nurses. It's to the point where it's almost a crisis, really, of not having enough people to do this really important job.
Oh my God, wow, yeah. I want to hear more.
There's something that often happens in high stress, high stakes jobs. Things like the military, fire departments, oil rigs, mines, fishing boats. Jobs where mistakes can literally be a matter of life and death. In jobs like that, there's often a culture of toughness that develops. The way I can prove that I can handle this is by showing that I'm not just strong, but stronger than strong. I don't need to eat. I don't need to sleep. I don't need bathroom breaks. I'm a superhero. I live only for the job. This happens in hospitals, too. Even on the best days, you're constantly dealing with people who are sick, upset, confused, angry, in a state of active, life-threatening crisis. And no one is closer to that stress, having to do more intimate care for people in crisis than nurses. Here's Pamela Pichon, Director of Nursing Excellence here at Roswell Park.
I think that the nursing profession feels that the most because we've always been that connection that stays with the patient the longest. In acute care, we're with them 24 hours a day. Not even our coworkers can always see everything that's going through this brain as I am standing outside your room preparing the medications that I'm going to give to you. What should I expect to happen in the next 30 minutes, 5 minutes, 20 minutes? What should I expect to happen? And if I don't see it, I got to set a timer in my head to come back and see if that's working. How is that going to interact with the other 20 that I'm giving you? Wait a minute, have they gone to the bathroom? All while, say, a family member's asking a question, a doctor's asking a question, an aide is asking, all at once. And I have really only given you the tip of what it is. I'm going to hear about all those other things you haven't told me, and you haven't told the doctor, and you haven't told your family. And I am also thinking, all right, are they going back home from here? Are they going to a nursing home? Are they going to rehab? Are they homeless? All of those things happening at the same time. And when you've got 8 people you're doing that for, you've got to keep all of that in line while still trying to be very compassionate, because that is really at the heart of what we do. And how do you keep track of all of that while trying to just maintain who you are? All of those things that you're dealing with personally, you've got to tamp down for a while. So there used to be it would be a badge of honor if you could go through your whole day with not eating lunch or not taking a break.
And here's Amy Gallagher, Director of our Employee Resiliency Program.
We definitely, especially in physical health care, have a culture of wanting to do more, to be a bit of a martyr in some ways, and to make sure that you're doing everything that you can for your patients. And that is great, except when it starts to affect the individuals who are providing care for folks.
We're starting to see that, no, that's not an honor anymore. We need to stop doing that. We need to take care of ourselves so that we can keep going.
Because as amazing as nurses are, they are still human beings. They can use adrenaline and pride and willpower to push through unreasonable situations for a remarkable amount of time. But eventually, anyone who is not taking care of themselves is going to shut down.
And you might have burnout, and that is where every day is a bad day. It's very hard to get up in the morning. It's hard to go to work. Emotionally, physically exhausted, putting more and more space between themselves and their job.
Burnout among nurses is a huge problem. The American Nurses Association ran a survey of their members in 2020, and 62% of them reported sometimes feeling this way. And what does that lead to? Unfortunately, a national shortage of nurses.
We tend to bury it real deep. We don't cope with it in the healthiest ways. Leads into, I don't want to do this anymore. I would rather be a welder. And when we have healthcare saying, I don't want to do this anymore, who's left to take care of you?
Roswell Park is part of a growing movement of hospitals that is trying to turn this tide by taking better care of their nursing staff, making sure they have what they need to do their best work, feel appreciated, not be exhausted and demoralized. This starts by really trying to understand the causes of burnout so we can address them systematically.
Yeah, so part of it is individual, but usually that's a small part of it, and larger part is organizational. One of the ways in which you can start combating it is to understand what those burnout drivers are. There are 6 researched burnout drivers that have been established in the literature. When you look at those, and it might be different on different teams or for different folks, but when you start looking at those drivers and trying to implement ways in which you can start alleviating those drivers, you may be able to see some change for folks.
The 6 recognized drivers of burnout are workload, relationships, fairness, autonomy, recognition, and values conflict. I'll let Dr. Gallagher describe each of these in detail.
First off is what we always think about when we think about burnout is too much work. So workload is the big one, as you can imagine. However, that is not the full story. You can be doing something 60 hours a week and love it, and you might be doing okay, right? You might not be at risk for burnout. Next is relationships. So do you have strong relationships at work? Do you have a work best friend? Do you have somebody that you can share all the good with and also commiserate with when you might be having a bad day? Next, we can think about fairness. Are things fair on your team or in your organization? Are folks being offered the same opportunities as other people on their team? Is everybody being treated equitably? Autonomy is another one. Do we have a sense of control over our work day or our work life? Next is around recognition. Are you being recognized for the work that you do in ways that make sense for you? And then finally is values conflict. And are your own personal values in line with the values of the organization or the team that you're working on? Are the people that you're working with walking the walk and talking the talk as well?
The most extreme examples of this kind of values mismatch lead to something referred to as moral distress. This happens basically because medicine is a team sport. Doctors prescribe courses of treatment. Insurance companies approve payment for them or don't. And patients have the right to accept or decline or insist on something else. So sometimes nurses are in a position of having to deliver care that they don't personally believe is the best course of action. This can be emotionally challenging.
Moral distress is this notion that, say, a nurse or a doctor, anybody, you know the ethical, moral, right thing to do, but barriers and constraints prevent you from doing that. So say this is the right treatment, the side effects it might have are going to cause a lot of problems with this patient. Perhaps they want it, and that's the order. You have to give it. I might have some distress, like, what is happening? Why are they doing this? This is a really horrible decision to make, that I have to do this because it's my job. That can create moral distress. And in moral distress, you can have moral residue. So say you do the same thing day after day after day. You get a little bit of residue from each one, which then goes into a moral crescendo, so that as you have that residue every time, it gets worse and worse and worse. It drops off. And then the next one, it just gets worse and worse and worse.
Clearly, there is work to do here. If we're going to keep experienced nurses on the job and attract new people, we're going to need to address and make progress in each of these areas. At Roswell Park, we're trying to do that in a number of ways.
I can't dictate what the workload is on teams or whatnot. However, we can start teaching folks about workload and helping people be comfortable enough to ask for help when they need help or when they are starting to feel a little bit overloaded with their work. part of that is being able to create a level of psychological safety on teams. And when you have high levels of psychological safety, people aren't afraid of raising their hand and asking for help. They know that it's okay to need extra help at different times, and they might be willing to help out a little bit more when someone else is in need of a break or needs some help. Something that we try to promote is this concept called check you, check two. And, the concept is that if you're coming into work, checking in on yourself. How are you doing? How's your emotional state? Do you need anything or any help or assistance as you're going into the work day? And if you're doing okay today, check two. Check in on two of your coworkers. What do they need? How are they doing? Make sure that they know that they matter, which can just be like, hey, how's it going today? Or, hey, I know that you had that event last night. How did that go? Or whatever it is, it just promotes that concept that you matter or that your coworkers matter. And that can help build the relationships and foster those relationships as well.
Another innovation draws on a long-standing system in hospitals of call codes. These are color-coded signals to the team when something urgent is happening. Code blue might mean that someone is in cardiac arrest, for instance, or code silver might mean you need help from the security team. We've added something called code lavender, which means that a member of the staff is exhausted or emotionally distraught and needs a little extra support.
So say you've had a particularly rough floor that week, a rough unit. Maybe you've had a patient pass away. Maybe you've had some patients go downhill or get really sick. You can call a code lavender where you have a team come to your unit and they can provide some spiritual counseling. They can provide some just one-on-one talking. They can bring tea and coffee, but the people come and the people come to help.
We sometimes bring up the snack cart. Sometimes if the therapy dogs are available, we might see if we can schedule a therapy dog visit, but just a way to let the team know that there's extra support for them to deal with whatever situation's going on.
And nurses, managers, anybody can activate that code lavender.
Also regularly round on inpatient floors and outpatient ambulatory clinic floors in order just to check in on folks. We're wanting to lend a listening ear and provide an opportunity for folks to, if they're having a good day, to celebrate that, but also if they need somebody to talk to, that we become familiar faces and trusted faces when things are difficult for folks.
As great as these systems for personal support are, they won't mean much if they're not coupled with larger organizational systems that show that nurses are appreciated and listened to. This has led to programs that really encourage accountability from senior management.
So really, we like to promote this concept of you said, we did. And what information are people telling us? How are we receiving that information? And then knowing that somebody took the time to share information with us, we want to make sure that we circle back with them or circle back with that team to say, hey, you shared this information. Thank you. Great suggestion. We took it up the flagpole or we discussed it with X, Y, or Z committee. And this is what they said. And this is what's going to happen next.
Because so often we will get it as leaders get into fixing that thing and we never tell anybody what we did. But if you don't tell them what you did, their perception is you didn't do anything. So that you said we did is a quick and easy mechanism to show them that you did something about it, which can build your satisfaction, things like that.
Word that popped in my mind while you were describing all that was empowerment. Giving the nurses the respect and tools to make choices about patient care that they feel good about and not just be a medicine delivery robot.
There is research out there that says if you get the input from the people closest to the job, you'll have better outcomes. What are you doing to make sure they are using that voice to improve care? So I'm so incredibly proud of this structure that we have, having shared governance and nurses, any staff member being able to use their voice to improve the care that they provide. That is something huge that we have here. We have up to 29 different councils and committees that nurses can sit on to say, this is what I think should happen for us to prevent falls. This is what I think should happen for us to improve patient satisfaction in this area. If you did this way, that outcome would be better.
Just by doing that can really give folks a level of empowerment that, hey, what my voice said mattered. And that's really great. And you know what? It's a bummer that changes aren't going to happen, but at least somebody heard it, if a change isn't going to be happening.
And maybe I've gotten a reason. I've been
and you got a reason. Exactly.
Yeah, it's almost like the way to make people feel that you're listening to them is to listen to them.
Yeah. Amazing. Yes.
The way to make people feel empowered is to empower them.
That's how it, yes. That's how it goes. People know that they were taken seriously. And once again, it gets back to relationships. You matter. And, when people know that they matter, that's a good thing.
And this kind of support and mutual respect helps nurses get back to the thing that was probably the reason they got into nursing to begin with. Caring for people can be really wonderful.
There aren't many of us nurses selling nursing as a real rewarding profession. And it really is. I wish there were more people out there saying how good it felt to go in and see Joan that day. And Joan was so excited to see you. Her face lit up, even though you were coming in to give her something that she might not feel so great after she gets it. But that cup, they fill your cup back up and you feel so rewarded for that job that you got to do. And for when people are like, oh my gosh, you're a nurse, that's wonderful. I'm like, yeah, it really is. I love it. You don't get that everywhere. That's what makes us feel good. That's what keeps us going, is I care about what I do. I care about doing a good job. I care about making a meaningful difference in someone's life. It pushes us and challenges us to make the environment that we work in better for nurses so that nurses want to stay. It challenges us to make the outcomes that we have for patients better. We're just planting the seeds, right? Even right now, talking about it, we're planting the seeds.
Thanks for listening to Smarter Than Cancer, a production of Roswell Park Comprehensive Cancer Center.
This series is produced by your hosts, David Hoffman and Hajar Eldas, and also by Jesse Rivkin.
Production oversight by Peter Sosha.
Additional logistics and support from Michelle Eisenstein.
Our production partner for this series is Citizen Racecar.
Post-production by Gregory Schweitzer for DCP Entertainment.
Publication and promotion supervised by Candice Chanteloup. If you or your loved one has been diagnosed with cancer and would like to schedule an appointment with Roswell Park, please call 1-800-ROSWELL. That's 1-800-ROSWELL. Or visit us at roswellpark.org.
If you're enjoying this series, we'd love to hear from you. Please reach out and tell us about your cancer story, and let us know what topics you'd like us to cover in future episodes by filling out the form at roswellpark.org/smarterthancancer.
And if you know someone else who might find value in what we're doing, please tell them about it. You can listen and subscribe wherever you get your podcasts.